Good morning, everyone, and welcome to the Minnesota Department of Health Stroke Education Series. This month, we will be providing a Minnesota Stroke Program update on our grant and educational activities. Before we get started, let's cover a couple of housekeeping items and the MDH Stroke Program updates. This webinar is part of the MDH Stroke Program Monthly Education Series. Stay tuned to your email for a different educational opportunity each month. Please note that this webinar is being recorded, and you can access all of previously recorded MDH webinars on our MDH YouTube playlist. Your lines have been muted upon entry. Please ask questions by typing them in the chat throughout the presentation. If we do not get to all of your questions, we will try to address them in a follow-up email. As far as our agenda today, we're going to cover program announcements. We're going to review the learning objectives. Nikki will cover an overview of our new CDC grant. Mimi will then cover the summary of the stroke training needs assessment. And then I will be covering what's next in the MDH Stroke Program Education Series. The 2022 Stroke Quality Improvement Awards for hospitals and EMS agencies launched this spring. Consider applying and showcasing your great QI and PI work if you haven't already. Check out our website with further information and contact our program staff with any further questions. Next month's educational event is sponsored by the American Heart Association. They are hosting a Minnesota Stroke webinar on July 21st. Registration info will go out in this webinar follow-up email. Our learning objectives for today are to communicate the current activities supported by the CDC Paul Coverdale National Acute Stroke Program grant that Minnesota Stroke Program has prioritized. We will also identify the stroke education topics most commonly included in the hospital and EMS stroke training programs. And we will describe the resources available to you on the MDH Learning Center and YouTube. Now I will turn it over to Nikki.
All right. Hi, everyone. Thanks for kicking off the webinar here today, Catherine. Happy to be here today and happy almost summer. Summer officially starts next week, although it most certainly felt like summer for most of us here in Minnesota just yesterday. I'm just going to take a few minutes to talk about our program, things that we're working on and what we're planning to work on over the next year here. For those of you that are new on the line, I thought I'd give a quick history of the program and to give you a short little update. And if you ever need any more information, please don't hesitate to reach out to our staff here at MDH. We'd be happy to give a larger overview of the system. So the stroke program has two main components. And the first is the CDC Paul Coverdale National Acute Stroke Program. We've been funded by CDC since 2007 to develop the stroke system of care. Minnesota was fortunate enough to be one of 13 grant recipients, yet again in 2021, and we are entering year 2 of this funding cycle. The second area of our program or funding stream is funding through Minnesota legislative appropriation. This primarily supports our voluntary designation program for acute stroke-ready hospitals, primary stroke centers, and comprehensive stroke centers. And I know you all know this statement, we've heard it time and time again, that it takes a village. And well, I think it most certainly does, that holds true. We are very fortunate to have amazing partners like all of you throughout the state to do this important work. Watching the evolution of the stroke system has truly been a privilege. And I'd like to also acknowledge the work of the stroke team here at the Minnesota Department of Health. We have a talented group of individuals that lead this work across the stroke care continuum. Here's an updated list of our team members for the stroke program. Some of you may know this, but this may be new information for others, that the stroke team is actually part of even a larger team within the Department of Health known as the Cardiovascular Health Unit. Combined, heart disease and stroke are responsible for about 1/4 of all deaths in Minnesota, ranking just ahead of cancer as the #1 cause of death. The Cardiovascular Health Unit works to strengthen communities and reduce the burden of both stroke and cardiovascular disease in Minnesota. As we are wrapping up this first year of the grant cycle, we thought it was a good time to give an update on the work we are doing. We mentioned at our webinar in October that there are 6 strategies that lead our work, And each of our work plan activities align with one of the following strategies. So the first is leveraging technology to identify patients with stroke risk factors. Second is to expand the statewide data infrastructure, which many of you know as the Minnesota Stroke Registry that's housed within the portal, or others use Get with the Guidelines. We want to analyze data to identify areas for quality improvement, develop professional education and learning opportunities. Another strategy is to establish and strengthen partnerships that provide support for stroke survivors and those at highest risk for stroke events. And lastly, the last strategy is to facilitate and expand the engagement of patient navigators and CHWs for those at highest risk and for also those stroke survivors for discharge support. From the strategies, we then separate this work into a few domains: prevention and community engagement, pre-hospital, data collection, quality improvement, and education. First, I'll start with prevention and community engagement. We've been working with our teammates in the cardiovascular health unit to continue to build relationships with FQHCs, which are federally qualified health centers. Presently, we are exploring tools to identify those at risk for stroke events and providing resources. Many of you worked with Kay, our previous transitions of care coordinator. Note that I said previous. Kay has recently transitioned over to another team at MDH, but continues to support the stroke program through collaborative efforts to provide stroke resources to those participating in the SAGE Plus program. SAGE Plus helps to keep women in Minnesota healthy by addressing their cardiovascular disease risk, providing education, and ongoing support for lifestyle changes. We're also working with a few health systems and community-based community-based programs to provide resources for stroke survivors and those at highest risks for stroke. And lastly, we're working with a few programs to increase engagement of healthcare extenders as it relates to stroke In the United States, healthcare extenders such as pharmacists, community health workers, community paramedics, and patient navigators help us meet our national health goals by conducting activities and interventions that promote health and prevent diseases and disability. In the pre-hospital arena, we recently launched the EMS QI Awards program, which Catherine mentioned here earlier in previous slides. We want to be able to recognize the great work happening in this setting. And we're also working to encourage EMS agencies to adopt a stroke severity tool for use in the pre-hospital setting. Over the coming months, more information and resources will be shared on this work. One resource we're super excited about is an evidence-based strategy for stroke identification in the pre-hospital setting with use of a stroke severity tool document that will be available for use in the future. We've been collecting data here in Minnesota for many years, and many of you use our homegrown system, which is the registry. We've been working with our developers to enhance this tool and add more usable reports and other elements too that are required for abstraction, and also removing some elements. This work's been delayed some for various reasons, but the work is continuing to move forward, and we'll share updates with you once the platform is ready and those updates are available. For those of you familiar with the program, many of you have experienced the chart audit process. We're working on contracting now, and you should be hearing from the contractor later in the summer to begin this very important work. This helps us to know what areas we can improve upon as a state, and also as it relates to chart abstraction and our guidance, where can we as MDH improve what we are providing for you as users? We'll be working with our EPIs and research scientists on our team to analyze our stroke data and hope to have a report to share with internal and external partners in the future. You all know quality improvement is one of the principal cornerstones of the work we all do. Our team has developed electronic versions of the mid-cycle survey and immediate action plans to streamline QI tracking and monitoring. And we look forward to being able to report that and report on statewide QI efforts in the future. For the acute stroke readies, many of you have signed up to join the QI Collaborative, which is super exciting and going to be led by Ali Fuji, the Quality Improvement Coordinator. This is going to be a great opportunity. Peer-to-peer sharing across the acute stroke ready arena. If you have any questions about this program, please make sure to reach out to Ali directly. The Stroke Advisory Group, which is made up of primary and comprehensive stroke centers throughout the Minnesota stroke system, is currently working collectively to improve dysphagia screening across these levels of designation. So we'll be sharing updates about that in the future and our results, hopefully in a positive way. And then we plan to continue to showcase the great work that you guys are all doing through the QI Awards program as well. That's the hospital-based program. Education is the last main that I'm just briefly going to mention as a focus area of our work. Mimi and Catherine are going to provide more details on what we've worked on and where we plan to go from here. So with that, I'm going to hand things over to Mimi. And you should be Mimi.
Yes, I can advance the slides now. Thanks, Nikki. Hi, everyone. So my name is Mimi Ameling. I'm the evaluation specialist for the stroke program here. And today I'm going to share a few of the results from our hospital and EMS stroke training needs assessment that we conducted last fall. So a little bit of background, we did this needs assessment to learn more about current stroke education programs in both hospitals and EMS agencies throughout Minnesota. We wanted to identify potential gaps, opportunities, and preferences for future trainings that we may offer from the Minnesota Stroke Program. And then we also were looking to lay the groundwork for offering new trainings focused on health equity and related issues. So we were looking at cultural competency, health disparities, structural racism, and bias. I have a feeling that a number of you on the call today actually responded to this needs assessment, so thank you so much for that. If that's the case, then you know that this was an online survey. We had one version for hospitals, one version for our EMS agencies, and these were distributed on our online survey platform in October and November 2021. So we had an 85% response rate from our hospitals. We got 105 surveys back. That is an unheard of response rate in the world of surveys. That's incredible. So again, thank you so much if you were one of the people that responded to this assessment. We credit this high response rate to the fact that we do have a history of conducting annual surveys, hospital surveys, surveys of stroke coordinators, as well as existing relationships and really good up-to-date contact information. For EMS agencies, we heard back from 40% of agencies, so we got 95 surveys. That's definitely lower than hospitals, but actually in the survey world, that's still considered quite good. And we felt we definitely had enough responses that we could draw some good conclusions about stroke training in EMS agencies as well as hospitals. So one of the first questions we asked was, who plans and coordinates stroke education at your hospital? This was a multi-response question, so you can see that these numbers add up to much more than 100%. That shows us that at most hospitals, there's more than one person or more than one department that has a hand in planning stroke education. But really in 83% of hospitals, it's a stroke coordinator. And so we share this because we know that our stroke coordinators wear many different hats and have many responsibilities both within and beyond their roles on the stroke team. And so this really confirms for us that we need to make it as sort of simple and accessible as possible to provide stroke education. We see a similar pattern in EMS. So again, multiple people may be involved in stroke education, but in most cases, there's a training officer who has this role. And again, we know that there are many other topics that they are coordinating education on. Stroke is just one of those. So the easier we can make it, the better. We asked which organizations would be trusted to deliver staff training. In hospitals, AHA and MDH came out, over 95%, so quite high, followed by hospitals, health systems, and the CDC. In EMS, it looks a little bit different. Hospitals and health systems were the most trusted, and I think that reflects the fact that in about 15% of EMS agencies, the local hospital education department is involved in coordinating or providing stroke education to staff. Hospitals are followed by AHA, and then a number of EMS-specific sources, so annual EMS conferences, training centers, and the EMS regions. MDH is coming in at 68% here, kind of towards the bottom half of the graph. And that really tells us that we should be looking to partner with those EMS organizations, with AHA, and that's really going to be a strength for us versus putting things out sort of on our own. When it comes to topics, we see in hospitals that Altaplace, stroke guidelines, and evidence-based practices and the NIHSS were the most frequently covered by stroke education programs. We sort of fall off from there, and we see some topics that are important that aren't being covered as frequently. So this shows us that, you know, those top 3 topics, hospitals are doing a great job getting those covered. Where we might be able to come in and provide support is hitting on those topics towards the bottom. So as we're planning future educational opportunities, we'll be looking at this chart and picking from sort of that bottom half of topics. Similarly with EMS, we see pre-hospital stroke scales, stroke protocols, stroke code activation. Those are really well covered. And then we have a number of topics, you know, mock stroke codes or LVO stroke scales that are less frequently included in training programs. So I will now turn to our topics related to health equity. We have a number of different slides on this, a lot of data. So I'm just going to highlight things and sort of show you what the trends looked like. So in hospitals, 56% were providing some education on cultural competency to their staff. 45% were covering bias. The numbers were a bit lower for structural racism and health disparities. But again, we're looking at over half of hospitals are covering cultural competency, and this is any education, so it's not necessarily specific to stroke. I took a look at these results by designation type, and we did see across the 4 topics that our PSC/CSC hospitals were more likely to be providing education on these issues. But if we look at cultural competency here, we see over half of our acute stroke ready hospitals are also covering this topic. So we do see higher rates on the PSC/CSC side, but that definitely doesn't mean that none of our acute stroke readies are providing this education. So that was quite cool to see. In EMS in general, these topics are less likely to be covered in education programs. So these were our 2 highest, cultural competency covered at 35%, health disparities at 31%. Again, these are lower rates, but that's about a third of EMS agencies. In EMS, we looked at our agencies in the metro region compared to agencies in our non-metro regions. And we did see that the metro was more likely to be covering these topics. But again, our non-metro agencies, you know, a number of them still were. So in this case, for health disparities, 28% of our non-metro agencies are providing some education on this topic. Finally, we asked about interest. So 50% of hospitals are interested in adding some staff education on health disparities, about the same for cultural competency. That's great to see. In EMS, 44% were interested in education on health disparities, a little bit lower percentage there for cultural competency. We also included an option for unsure on these questions because we thought that this might be, in some cases, a newer question or topic. And so we wanted to create space for that uncertainty. And we certainly do see it. So when we look at these bars for EMS, we see things falling into thirds or somewhere close to that, where we have 25 to 30% of folks not quite sure yet if they want to start covering these topics. And I'll talk more about that when I get to our recommendations. So to summarize, overall, the results that we saw were very consistent with our expectations for both hospital and EMS settings. We did not identify any glaring gaps in stroke education, but we did see some opportunities, and we learned a little bit about what we can do to increase our offerings and our support for stroke education. Again, we see those PSC, CSC hospitals, Metro EMS agencies more likely to provide education right now on our health disparities topics, but there is some education already happening on those topics at all types of hospitals and throughout the state. And there's definitely interest. So that was encouraging to see. Both hospitals and EMS agencies are interested in adding education on these topics, although there is some uncertainty. We did get some qualitative comments back from EMS agencies that wondered about the relevance of these topics in the work that they do and wondered why these are things that we are starting to ask about. So what are our recommendations? What are our takeaways? First, we will be looking to provide educational content that's ready to use, can be delivered asynchronously or very easily accessed. We know that stroke coordinators need support in fulfilling their multiple responsibilities. We also heard from several EMS agencies that they really need trainings that are going to be accessible for volunteers who have full-time jobs outside of the field, so they can't come to something that's happening in the middle of the day. We will be promoting our MDH Learning Center courses in both settings because we think that those actually really fit this bill already. They can be accessed at any time, they're online. When we're planning new education, we'll be focusing on topics that fall in the latter half of those charts that I showed. So things that are still really important, but are not always covered right now. And then again, we're going to seek partnership when it comes to providing education in the EMS space. And as we start to offer education on health disparities and related topics, we're going to proceed really intentionally. So we want to start with the why. We want to set sort of a base level of why are we talking about these topics? Why are they important for all of us, whether we work in public health, in a hospital, in an EMS agency, or a clinic? Again, we'll be seeking partnership with trusted sources as well as subject matter experts, and we'll really be aiming for quality over quantity. So that wraps things up for me on the training needs assessment. I'm going to go ahead and pass things back to Catherine, and she's going to talk a little bit about both our existing resources and what's coming up next for us in the education space.
Thank you, Mimi. I just wanted to give everyone a quick overview of the great resources we have available that people may not know about, plus some of our upcoming opportunities. Minnesota Department of Health has a learning management system for external partners called the MDH Learning Center. It is free to access, and there are paid and free courses available on the platform. We currently have 4 stroke-related courses in the learning management system. They are all free to access. To get started, you go to minnesota.myabsorb.com and then click the sign up button down below. Fill out the form and create a free account. After you create a free account and log in, this is the screen that you will see. There are 2 easy ways to find the stroke courses. You can use the looking glass on the top bar, located by the red circle. You can also use the catalog button on the bottom right, also located by the red circle there. When you click on the catalog button, you can then search on the left under the course name. Again, search for the word stroke. That's the easiest way to get the courses to come up. There's quite a few courses already loaded in the learning management system. And you'll get a folder that says Minnesota Department of Health. Click on that and the courses will appear. Unfortunately, this is one quirk to this learning management system that we've not been able to overcome at the moment. Hopefully soon. Here are our 4 courses that are available for free. We have the Acute Stroke Treatment Refresher course aimed at EMS professionals that covers pathophysiology, emergency treatment, hospital treatment, and rehab for stroke patients. So easy to miss, catching the subtle stroke, from the wonderful Joni Soames. We also have deficits to disability in acute ischemic stroke, addressing the considerations for potential stroke disability when deciding to treat a stroke. And our newest course, Best Practices Guidelines for Stroke, a pre-hospital and emergency management course. A wonderful course from Donna Lindsay addressing the best practice for EMS and hospital professionals. So as you can see, there's a wealth of knowledge of stroke care in this learning management system, all for free. The system will also administer contact hours and keep track of your courses to refer back to later. So now that you've seen what we have in our system, we have a quick poll for you regarding our learning management system. 1 second to open the poll. Please take the opportunity to fill this out for us. This will help us a great deal.
Since this webinar is being recorded, I'm not sure that the poll will show for the recording. So
Oh, yes.
we can just read those questions real
Yeah,
quick.
absolutely. So there's 3 questions that are being answered currently. The first question is, have you used the MDH Learning Center? Second question is, if yes, how user-friendly did you find the platform? The answers are very user-friendly, somewhat user-friendly, and not very user-friendly, or not at all user-friendly. And if you have not used it, why not? Either we haven't heard of the trainings or the Learning Center, not being able to set up or log in, not able to access the site, don't have time, not interested in the content, or using other resources for stroke education on the poll. About 40 seconds left on the poll. Got a handful of people that have not started it. If you have a chance, that would be great. And we'll display the answers at the end so that people can see. Ten seconds left. Thank you for taking the time to take this poll. This was actually going to help focus our efforts on this learning center here. Just a second to finish here. 2. Here are our poll results. As you can see, we have some work to do promoting our learning center. This is a great platform for us to use. It's a platform we've had going for a while, but we need to get on promoting it, looks like. So thank you everyone for taking the poll. I really appreciate it. That's going to help us focus our efforts. Here. All right. Our other great resource for stroke information is YouTube. We have all of our webinars recorded and posted on our YouTube playlist. Our most recent webinars have links to this in the description to a survey which you can fill out and receive your contact hours. And those are still open. And we encourage you to attend those and watch those when you have a moment. Shop reel here real quick. We are always open to new topics or updating previously covered topics. Please don't hesitate to put your ideas in the survey after this webinar. Our planned upcoming webinars will cover topics like intracerebral hemorrhage, guideline updates, health disparities, and we'll be trying something new that we like to call the bite-sized trainings. Stay tuned for more details. Thank you for joining us today. Please use the chat feature to type in your questions or press *6 to unmute your lines. I know we're right on the dot here, so please feel free to leave comments in the survey if you have any questions or contact us. The link to the survey will be placed in the chat. Please remember to click on the chat bubble in order to view the chat box. Upon completion of the evaluation, you will receive your 0.5 contact hour. And that's all we have for today. Please stay tuned for our email for our monthly educational opportunities. Stay well and take care, everyone.